Welcome back, everyone. Thank you for attending our first webinar under the Career Guidance Series US. For those of you who don't know what Alfaisal MedHub is, it is an initiative under the umbrella of the International Office at the College of Medicine that aims at creating a global online community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world, and the Career Guidance Series and podcasts are its main initiatives. Our primary objective at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. Since medical students are usually confused about the path that's ahead of them, Alfaisal MedHub's Career Guidance Series addresses this challenge from the perspective of accomplished and experienced seniors. We are excited to introduce to you Dr. Fatima Babiker, who will be delivering a webinar on the Career Guidance Series titled Applying to San Francisco Match to Pursue Ophthalmology. Dr. Fatima is a 7th batch alumna of the College of Medicine at Alfaisal University who graduated with first honors. She then worked as a teaching assistant under Dr. Salwa al-Hazza in the Ophthalmology Clerkship Department for a year. Aspiring to match into ophthalmology, she rotated at Kresge Eye Institute in Michigan and completed an externship with Dr. Jonathan Lin, professor of ophthalmic pathology at Stanford University in Palo Alto, California. She is currently a chief research fellow at Massachusetts Eye Research and Surgery Institute in Boston, Massachusetts. Earlier on, Dr. Fatima gave an overview of the SF Match service. It is a timeline and how it differs from the general match. And now she'll be discussing the pathway to ophthalmology via the SF Match, along with the following objectives. Is ophthalmology a competitive specialty, IMGs versus AMGs, overview of the selection criteria, networking via social media and connecting with mentors, work-life balance, how to survive your first couple of years. Thank you for joining us today. Doctor, you may begin whenever you're ready.
All right, thank you for that, Rafi. So I'm going to be starting the second talk about ophthalmology and how to pursue it as an international graduate. This one I'm very excited about, I'm very passionate about, and I've been asked so much about. There aren't a lot of Alfaisal graduates, sadly, who have taken this path. There's not a lot of information out there about it. So I'm more than happy to provide my own intake and hopefully help you guys figure out how to get in as well, if it's something that you want to do. All right. Okay, so I'm going to be covering a lot of things about applying to ophthalmology. Just as a disclaimer in the beginning, you're going to be provided with a lot of material that is going to help you. I wish I had been provided by just half of this stuff when I was applying, but hopefully this will help you a lot. I'm sure someone's going to upload my presentation somewhere, and you could always look back, see the links, see the references. Some of these things are going to help you a lot if ophthalmology is something that you want to pursue. Okay, so before we start delving deep into how to apply to ophthalmology, it's very important to understand why people choose it. Sadly, this is not a specialty that you get exposed to a lot. Some medical schools, they don't even have that specialty in their med school curriculum. We're fortunate at Alfaisal to be able to have, I think it was a two-week program under Dr. Salwa al-Hazza, where you are introduced a little bit to ophthalmology, but even that is a very small speck to the field as a whole. So today I'm going to be telling you a little bit in the beginning about why to choose this specialty, and then we're going to delve deep into how. So when I was trying to find a specialty in the beginning, one of my seniors presented me with this book. It's an amazing read. It's a great book that tells you all the pros and cons about all the different specialties. I highly advise you guys to actually read it. This is a very old edition, but there are newer editions out there that would help you a lot. It summarizes everything when it comes to lifestyle, finances, interest, requirements, everything about all the different specialties in medicine in the United States. So if the US is somewhere you want to apply to, reading this book really helps you determine, which specialty might be more suited for me. As I was reading this book, I was very surprised about some of the things that was mentioned about ophthalmology. And It wasn't really mentioned a lot during our rotation when I was a medical student. And so it was something I had to go and seek for myself. One of the things that it really highlighted was that it was a specialty that ticks all boxes almost. It provides very high financial value and very little stress when it comes to workload. It combines both surgery and medicine. It allows you to do all sorts of things, from dealing with medical problems with regular drops or pills, to doing minor procedures, to doing general anesthesia, major surgeries. And there's a very wide range of things you can do in ophthalmology. There are a lot of pros, not as many cons. And that was the surprising part for me. I was like, there must be a catch somewhere. I provided some data for you guys. Obviously, I'm very biased to this field. So I wanted to get some things that were objective that might help, give you a more realistic view on things. So when it comes to overall satisfaction, ophthalmology has always been one of the very highly ranked specialties in medicine in general. This data is taken from US physicians, so it might be different in other places in the world, but my main talk here is just mainly going to focus on the US. I will touch base a little bit at the end about chances outside the US, but for this data, it's mainly from the US. So it's always fluctuated between the top 5 positions. It was ranked first at some point, and then it was ranked third, and then second, and then it keeps flip-flopping by year, but it's always remained within the first 5 highly satisfactory specialties for doctors. And this is very important because you can be very passionate about a field, but it burns you out, and over the years that passion dies off and it doesn't become your main drive anymore. So other things at that time would take precedence in terms of your workload, how much work-life balance you have, are you able to support your family or not? All these other things start to really weigh in to how it affects your life. So because ophthalmology is a specialty that really provides a lot of financial value as compared to the workload. So if you look at the top 5 specialties here, even though it's ranked 5th in terms of overall satisfaction, it's the least one with workload amongst the first 5. Even if you look at the financial incentives, it's also one of the top. And especially, this is from Medscape 2023, so this is updated. It was ranked 2nd in terms of financial bonuses. So it's great in terms of that great balance between finances and workload, because orthopedic surgeons, plastic surgeons make a lot of money in the US. Their financial gain from these specialties is extremely high, but their workload and their burnout rate is very high as well, especially in orthopedic surgery. Their residency programs are tough, and that weighs into satisfaction. Satisfaction is not just about the finances. It also plays in role or takes into consideration how much workload you have and the burnout. So luckily, ophthalmology is a very low risk, low burnout specialty. So like I said, the book really made it sound like the specialty that ticks really all boxes. For me personally, I had a very high interest in the science of it as a medical student. It was the only specialty that I studied for fun, and not because I had an exam the next day, because I was really interested in the neurosciences of the retina and all that kind of stuff. That was really cool to me, but that's just my personal interest. The other pros is that, like I said before, it combines both surgery and medicine. So you're very rarely bored in ophthalmology. You have days where you're in the OR and you're doing your procedures. There are days where you could do procedures in the clinic you see patients in the clinic, you manage their medical conditions in the clinic. So it gives you the best of both worlds, really. If you're someone who's torn between, are you a surgical person or a medical kind of person, it gives you both. One of the most amazing things about advances is that ophthalmology is an extremely fast growing field. The advances in its technology are so fast, it's insane. The reason I'm saying this is because right now the fellowship that I'm currently in, it's a ocular immunology fellowship. We get to work firsthand with some of the new medications and some of the new drugs that are coming out for different rare diseases in ophthalmology. And it's shocking to me how you can go from someone that is potentially blind for the rest of their life to someone who could see perfectly for the rest of their life. One of the best examples for that is Dr. Sarwar Hazaz's contribution, where she provided a gene therapy that wasn't found anywhere except in certain countries in Europe and the US. She went to attend a conference in the US, and she found this gene therapy that worked for patients who have retinitis pigmentosa, which is one of the blinding diseases that's hereditary. That disease is rare in other parts of the world, especially here in the US. But in Saudi Arabia, because there is a high consanguinity rate and people marry cousins and stuff like that, familial diseases and hereditary diseases are a lot higher. One of them is retinitis pigmentosa. She had families and families who would go blind by the age of 25. So that's very young in your lifespan. So when she found this gene therapy, she fought to get it approved here or in Saudi Arabia. She was able to bring it all the way there, and she treated the first 11-year-old patient with that gene therapy. It's very interesting. She gave a wonderful talk how this 11-year-old girl, before she was treated with the gene therapy, they put her through a test where she was put in a room with a maze. This is a dark room that is slightly lit, where you could just about see your surroundings. As she was walking in this maze, she would bump into walls and not be able to figure out how to get out. They did the gene therapy for her, and then a few months after, they put her in the same room, the same maze with the same, dark atmosphere. She did not bump into a single wall. She walked all the way through the maze and could see perfectly. And that's going to be her outcome for the rest of her life. Meanwhile, her other family members were blind for the rest of their life. So that one medication, that one advancement in technology saved that girl's sight for life. That was mind-blowing to me. When Dr. Sarwar gave that talk, I was so shocked. And then coming here to the US and being able to see firsthand certain medications that would work. For example, thyrotoxicosis is a disease where your eyes bulge out. You have hyperthyroidism and Graves' disease and your eyes kind of bulge out. There used to be no treatment for that bulging out. That's it. They were like, you know what? Your connective tissue forced your eyes out. You're going to stay looking like a very scary kind of bulgy-eyed person for the rest of your life. 2 years ago, a new medication called Tepezza was released that allowed that process to regress and allowed these people's eyes to go back to their normal position, their swelling to go away. It was like magic. And I was shocked at the results and that these things actually work. There are hundreds of examples I can give you, but the beauty of ophthalmology is that out of all the specialties I have seen, this is definitely the most fastest growing one when it comes to technological advances, and its effect is extremely prominent. So the effect on people's lives, the effect on people's well-being is dramatically increased. And it's so refreshing as doctors, because that's all we wanted when we chose this field. So it's beautiful to see these things. The second thing is that it's a friendly environment. For me, as a Fatima Babiker, I don't like a lot of stress, and my friends can attest to that. I love friendly environments where you feel welcome, you feel at home, you don't feel like you're overly criticized or you're overly judged. Not all specialties provide that welcoming, friendly environment. Some specialties are very tough. My father's a general surgeon. Yeah. And my husband also works in internal medicine. So I've seen the different specialties and how their atmospheres can be slightly different. Ophthalmology is one of those specialties that are known to have happy doctors. And these are doctors that are just very friendly, very chill, very relaxed. The reason for this is because we tend to deal with a population that's most relatively healthy. We don't deal with heart failure. We don't deal with, acute kidney injuries or anything drastic that involves someone dying. So most of our patients are relatively okay. They can walk all the way to the clinic, come see, chat with us. So they're relatively physically wise, they're all right. So they're happy, and so are we. And that's why the atmosphere is very different. Even in residency programs, residency attendings that train you are a lot more friendlier. They're a lot more relaxed, a lot more forgiving, much more than other residency programs. Even the workload is a lot less. Ophthalmology was the only residency program that or residency specialty that allows residents to have both days off here in the US. I found out that that was a luxury, apparently. My husband, when he did internal medicine here, there was no such thing as both days off. That would be called a golden weekend if you had both days off. If you were lucky, you'd have one day off. Sometimes you don't have any days off, and you just work weeks on end. In ophthalmology, that's not the case. You have your weekends off as a resident almost every week. So in general, it's a very friendly environment. I really appreciated that when I was working with my doctors, because I thrive more in less stress environments. If you are the type of person who thrives more in stressful environments, I highly suggest general surgery. So the other part is the financial incentives. Like I mentioned from the previous data and the previous slides, it's a very high-paying specialty. And the beauty about its high pay is that the procedures that you do in ophthalmology don't take a lot of time. So cataract surgery can be maximum 10, 15 minutes. It doesn't take that long at all. Once you master it, you become even faster. I had an attending who had a stunning record of 1.5 minutes for a cataract surgery. They're very quick procedures. All eye procedures generally don't take time. That's unlike other general surgical procedures that would last from half an hour to an hour, or sometimes even more. If you're in neurosurgery, it could be 3 hours, 4 hours. So the ability to have short procedures means that you could do more of them. Now, each procedure already costs a lot here. So if you could do 10, 20 cataract surgeries, you'd be making more than someone who's doing, 2 heart transplants, because you're just doing more procedures. And people in ophthalmology have recognized that. That's why people have started to have rates of how many surgeries they can do. I've seen doctors who've done 60 cataract surgeries a day. I've seen ones who've done up to 70 cataract surgeries a day, which is insane. But the financial incentive from that it's mind-blowing. So it is very procedure-based. That's where the finances come. Now, the last part here, which is one of the things that drew me to the field, is it being family friendly. I'm the type of person who doesn't want medicine to be everything, and I don't want it to consume my life. Medical school consumes your life enough already. And by the time you graduate, you're just so exhausted and so drained. And then you have to go through residency and then fellowship, and it's just a never-ending process. So I wanted the specialty that I went into to provide me with at least the chance that the last 30 years of my life would be relatively chill. I didn't want to be in the grind all the time. And I definitely wanted to have other aspects of my life enhanced as well. Family, friends, relationships, religious connections, all that kind of stuff. Ophthalmology definitely provides that. And it provides that by giving you the flexibility in your schedule. It's very important that you I remind you that this is for the US, because in other countries, it's very different. But in the US, 80% of ophthalmologists that graduate from residency programs end up going into private practice. which means they link up with groups that are private groups that provide you clinics and ORs, but they're not affiliated with like a university or like a major public hospital, no. Those are great because they pay more and they give you the freedom of your schedule. Ophthalmologists can take off as many days of the week or as many days of the year as they want. They have the flexibility of choosing their hours. I have a female attending who only works 4 days a week, so she has 3 days off every single week. And during those 4 days, she only works from 9 to 3 p.m. and then she goes home. So if you can imagine all that time that she gets to spend home or with family or friends is golden time to cultivate other aspects of life rather than just medicine. So that flexibility isn't found in a lot of other specialties, especially ones that require on-calls, emergency cases. In ophthalmology, there are not a lot of emergency cases. And even the most drastic emergency cases usually doesn't involve life-death situations. That's why when I did my first on-call in ophthalmology in Saudi Arabia, it was in the Shimesi Hospital, I was shocked when throughout the on-call, the resident would be, called multiple times and they would take all their sweet time getting to the patient. And they'd be like, the patient is fine, nothing's going to happen to them, they're not going to die. Unlike other specialties where, no, you're rushing to get in there. I've seen specialties where there's like a 30-minute limit where if you don't get there, the patient's going to bleed to death. So the luxury of having time to think, to organize yourself and organize your thoughts is something I really loved about this specialty. It's very rewarding. Like I told you about the examples with Dr. Sadwa or other examples, affecting someone's vision is really life-changing, especially if their vision reached such bad levels where they cannot function, they can't do their work, they can't see their family members, they can't enjoy movies, they can't enjoy watching anything on any screen. Once you restore that vision, it's so drastically life-changing. It affects how that person feels, how they interact with their family. Some people get out of depression from it. It really impacts patients highly. And we see that. We see that in the clinic. We see that by how our patients react to our treatment. And it's so rewarding as a doctor as well. And because it's an immediate or it's a very fast rewarding specialty, that sense of satisfaction is something that is priceless. Not all specialties have that. Some specialties deal a lot more with chronic diseases that need long-term maintenance and don't really give that fast rewarding effect. But ophthalmology is definitely one of the fast rewarding ones. It is a very highly specialized field. You're focused on 2 small organs in your head. Don't get me wrong, you still deal with some conditions that involve systemic organs, but it's still a very highly specialized field. So the good thing about that is that even if you forget, 3/4 of what you took in med school, you're fine. You'll be okay. Now, with all that said, should there be a reason for you not to get into ophthalmology? Yes, absolutely. Even though, honestly, I feel like it's the specialty that ticks all boxes in terms of finances, work-life balance, interest, reward, everything, there are still some drawbacks that you need to keep in mind. The first one I put is because this was the reaction of one of the residents that was so passionate about ophthalmology. And then she went to King Khalid Eye Specialist Hospital and she did 1 year of residency there. She saw a lot of open globes where people's eyes were just completely torn into smithereens, and she couldn't handle it. It gave her the fright of her life, and she decided to quit ophthalmology. So eyeballs are not always pretty to look at, especially if they're deformed. So you need to have that kind of ability to tolerate gross looking eyeballs sometimes. If it's not something you can do, then maybe don't try the specialty. The second thing is manual dexterity, and this is one of the key things that makes you a stellar surgeon or would make you an okay, surgeon. Dealing with eye structures are very small, and they provide very small room to work in when you're doing your procedures. So you need to be able to adapt and use small instruments, be able to move in small spaces. So these kind of surgeries require a lot of manual dexterity. And that's not always something that everyone's gifted with. It's definitely something you can learn, you can grow. I've even seen surgeons who do certain exercises or certain stretches with their hands to try to like enhance. Not that any of that has any proven studies, but your manual abilities play a huge role. If you're the type of person who has shaky hands, tremors, just generally is not really well adapted with their hands, it might be a much trickier specialty for you. Some people, because of that, they end up not doing the surgical part of ophthalmology, and they chose to only do the medical part, which is something you can definitely do. When you only do the medical part, you lose out a lot on the financial aspect, but you could still practice, the medical part of ophthalmology, which is something I've seen happen a lot in the Middle East, especially with new mothers and stuff like that, which is okay. But manual dexterity is very important for those who want to be surgeons. Okay, if you prefer general medicine, yeah, I did not think that there would be people out there that would miss the rest of the body. But there are a lot of people like that, who prefer to act like, what do you call it? Investigators, or like Sherlock Holmes. They love mystery. They love the idea of having a vast list of possibilities and digging through those possibilities. And that could be intriguing or mentally stimulating for some people. It's not for me. It's a lot to handle, but the body's huge. But if you do prefer general medicine, then probably stepping into ophthalmology isn't for you. I actually did find someone who had a stellar CV, matched into ophthalmology. They did the transitional year here in the US. And once they did, they ended up finding a huge interest in internal medicine, and they switched from ophthalmology to internal medicine. It was the shock of my life, but they did that switch. So it's good to keep these things in mind, because not everyone is the same. People have different personalities. If you are the type of person who has a temperament where you're more introverted, you don't like to deal with human beings a lot, so you're the type of person who would be more suited for, let's say, radiology, pathology, or specialties that don't involve a lot of human interaction, ophthalmology would not be the place for you. There's a lot of human and social interactions in ophthalmology. It's very intense. So you need to have a little bit of that ability to socialize. Now, the last point is the point that I wanted to highlight, because most of my talk is about experience here in the US. Some other countries don't pay as much for ophthalmology procedures. Some countries, they don't give you as much flexibility in your schedule. So it might be more fixed or rigid. So not all of these factors apply everywhere. So you need to ask yourself, where do I want to practice in the world? If it's the US, this talk is perfect for you. If it's anywhere else, then you have to really look into what that country provides for their ophthalmologists, so that you could really weigh out risks and benefits. All right, so that's a lot about why to choose ophthalmology. As you could see, because there's a lot of pros, especially here in the US, a lot of people want it, especially here. And the American grads that apply to the US are a huge number. It's very competitive. All programs know that the financial versus work-life balance is a very big attractive factor, and sadly that's sometimes the only reason why some people apply, rather than a genuine interest in the science itself. So that's why it's one of the specialties that doesn't ask its applicants why you chose this field. That's a very common question for internal medicine applicants. peds applicants, but not in ophthalmology. They already know why you would choose the field, and they're very well aware of the perks of the field as well. So they're not really interested in that. They're more interested into seeing who you are as an applicant and what you can provide for the ophthalmology community rather than why you chose it. So that's a very interesting thing, because when I first wrote my first personal statement, I put so much emphasis in trying to describe why I loved ophthalmology. And then I was shocked when my attending read it and was like, we already know all this and we don't care. All we care about is seeing what qualifies you as an applicant, not why you're interested in the field. He's like, we're all interested in the field. Everyone is. And we know that pretty well. Now, it is a competitive field because of all the perks. And this part is the part that I don't like to dwell into too much. When you look at the statistics of the international graduates who matched into ophthalmology, it is frankly depressing. You will see these numbers and you would be like, okay, nope, there's no hope for me. I'm not doing this. And it's very easy to back out. When I actually dissected these numbers, it's very important to look at how many people applied versus how many people matched. Some people only look at how many people matched, and then they base their numbers off of that. If you look at the number of people who matched every year, it's very, very little. For example, in 2023, this last year, only 17 applicants were IMGs, 17. That's it. If you look at, peds, OBGYN, you're going to find numbers in the hundreds and the thousands. Here it's in the teens. If you look at 2022, it's 14 applicants. 2021, again, 14 applicants. So you look at these numbers and you're like, oh my goodness, this is impossible. It's very important to look at how many people applied. So in 2023, which is last year, only 59 international graduates participated in the SF match. Out of the entire world, only 59 people pursued ophthalmology in the United States. So then it would make sense why only 17 people matched, because less than half 100 applied anyway. So these factors are important to take into consideration. So if the number of people who applied was in the hundreds, the number of people who match would also change. And when we look at the trend yearly, we realize that there is a fixed 35 to 25% range of international graduates who match into ophthalmology every year. It's just that the number of applicants is very little. So in 2021, it was only 40 people who participated. In 2022, it was only 43. So the numbers are increasing a little bit, but it's just by a few numbers. It's not by tens or hundreds. So keeping that in mind gives you a more realistic idea that there aren't a lot of people applying to ophthalmology, which is why there aren't a lot of people who match. So keeping that in the back of your mind it's a lot more reassuring. So when people give you statistics and they throw numbers at you and it starts to become a little daunting, remind yourself that no, there are other reasons for those numbers. It's not that people just don't like international graduates. No, it's the fact that not a lot of us apply to the specialty to begin with. All right. So let's go into what are the obstacles of matching and how do you prepare to apply for the match in ophthalmology? This is the most important part of the talk. I summarize the obstacles into 3: time, money, and visa. If you have all 3 set, then you are good. If one of them is an issue, then you might need to reconsider your application or where you want to pursue ophthalmology. So ophthalmology, to match into it, it's not as impossible as people make it. One of the first things I was told when I wanted to approach the specialty was that it's impossible and that I should not waste my time and that I'm going to waste years and years of my life and I'm just not going to get in. That is a very false narrative. And thankfully, coming to the US and seeing international graduates who did match and who successfully did so, and they're living their best lives, gave me the assurance that No, it absolutely is possible. It is within your reach. It just requires a little bit more effort and time. Why do I say time? Because as an international graduate, one of the biggest factors that helps you to get in is research. And it needs to be a certain amount of research. So it's the type of research that is high quality. So nothing like surveys or case reports. No, it needs to be either prospective or retrospective long-term study, published in a well-known journal. It has to be an American journal, or supported by physicians who are American grads. That kind of publication requires time. You can't do that within a few weeks or a month. And because as international graduates, we have to be outstanding in this research, because even American grads need to do a lot of research to get into ophthalmology. So we need to be even more stellar. So the number I was told was 10, a minimum of 10 publications so that you could be competitive to match into ophthalmology. And I think that's a relatively fair number. The higher, the better. But to publish more than 10, you cannot do that in a year. You could try if you want to. The quality of these studies might be a little bit less, but if you put all your hard work and effort into it, it's definitely possible, and I've seen it happen. But generally speaking, most people need from 2 to 3 years to be able to publish that number, that huge number of publications. So you would need those extra 2-3 years to do these publications before you can apply to the match. Now, that's not the case in other specialties. You don't need 10 plus publications to match into internal medicine or into pediatrics or OBGYN. No, I've seen people match without any publications. I've seen people match with just one. So generally speaking, because ophthalmology requires a very high research background, that's where the time factor comes in. So if you're the type of person who can spare 2 to 3 years to do research, then you're all set. If 2 to 3 years sounds like too long of a wait for you, in the sense that, no, you want to go into residency right after med school, then that would be a hindering factor for you. The second thing is money. Sadly, research positions here in the US, not all of them are funded. And even the ones that are, they don't give you enough finances to cover you completely. So most of the time, those 2 to 3 years that I'm telling you about are financed and funded completely by you or your family. That could weigh a lot with some people, especially we're in a time where there's a lot of wars, a lot of issues, and not everyone has that financial backing. This is one of the biggest factors really that affects application, because it's not cheap. Using the tools, buying the tools is not cheap. Applying to the programs is not cheap. The going to conferences, all of these things, it requires that financial backing. So that is definitely the second hindrance. The last hindrance is visa. And the good thing about the ophthalmology match is that the program directors are very frank, they're very direct, and they will tell you very bluntly that they do not accept people who don't have a visa or that have a visa that doesn't allow them to work in the United States. Anyone with visa issues, they don't want to deal with. And the reason for that is because the number of spots are very limited, and they already have a huge amount of applicants from the US. So in order to favor an international graduate, they don't really want to deal with applying for a visa for this person or having that hassle of, introducing or searching for a visa for that person. So most applicants need to sort out their visa issues by themselves. And that's one of the biggest downsides. That's not the case with other specialties. I know in internal medicine, they can fund your visa for you. They can help you apply for a J1 visa. And that's how most people from Alfaisal were able to go and work there. So you would need to find your visa, and it needs to be a visa that allows you to work in the US, because B1 visas, tourism visas, these are also all visas that prevent you from working, and they don't allow you to gain a salary from any job in the US. So it needs to be a visa that allows you to work. The better the status of your visa, the higher your chances of matching. It's a sad fact, but it is a fact. And the earlier you realize that fact, the more you accept it and try to work around it. Does it mean it's impossible for people who don't have visas? No, absolutely not. I do know residents, international graduates that were able to secure visas for themselves. They came from nothing and they're able to secure visas for themselves through other means. There's many, many routes to get visas here in the US. And through those routes, they secured it for themselves and then they applied to ophthalmology. So it's just that you're all on your own when it comes to the visa issue, unlike other specialties that might help you apply for J1 or other visa processes. For ophthalmology, it's something you would have to deal with, sadly, even before you apply, because your status would also determine the likelihood of you matching as well. So these are the three hindrances. Some of them are big, like the visa issue could be big for many people. The money part I can see can be big. If those two are relatively okay, where you don't mind working a little extra to try to apply for a visa in the US, you have, family or friend or husband or someone who could financially back you, and you don't mind spending 2 extra years out after medical school, then you're all set. For me, my personal journey, I did not have a visa before coming here. I had to apply through an immigration process that my husband helped me with, and I secured that for myself. Financially, thankfully, I had my family's backing. Time-wise, that is the part that, to me, I felt like is the easiest side for me. So I have a lot of friends who went into other specialties because they were easier to get into, whether it's psychiatry, general medicine, internal medicine, peds. They weren't fully convinced by these specialties, but they were a lot more doable and easier than these high competitive specialties. Now, it would still require you a lot of work to get in. It won't be a complete piece of cake, but even when you do get in, it's your work life afterwards that determines the true success. If you have finished and completed residency by age 28 versus by age 35, it wouldn't matter. What would matter is how is your quality of life for the rest of the 30, 40, 50 years that you're alive? Is it where you're happy? There's a lot of, reward when it comes to your job. You are happy at your job, you're content, you're satisfied with your outcome. If that's the case, then that's the true success. If you feel like you're working intense number of hours, you are not satisfied in your job, you don't feel that reward, then eventually you might be very highly motivated in the beginning, but you reach an age, you reach a certain point where that starts to become very draining. So true success is landing in a specialty that makes you completely fulfilled, regardless of what that specialty is. So spending an extra year or 2 years, or in my eyes, even 5, but getting where you want to get is completely worth it. And that's the real mentality of all the IMGs that have matched into ophthalmology. Majority of them have that sense that, you know what, we're going to do this for the long run. It doesn't matter how long it takes to get there, but we want to get there. And they do. Even if their step scores were low, even if there were certain parts in their CV that were not optimum, they still did the time and they were able to match. So if you don't have that urgent sense of you have to get into a residency program directly or immediately, then ophthalmology is for you. So these are the 3 main big barriers for pursuing ophthalmology. And I'm going to tell you or show you a plan or a way that how IMGs match successfully with these restrictions. So generally speaking, these are the requirements to match. So I told you before, you need a lot of research, minimum 10 plus publications, preferably ones that are in American journals, backed up by American physicians. So publications that are like case series, case reports by someone they don't know outside the US don't really help much. It's mainly the research that you do in the US that counts. Even if you just do surveys in the US, that still would count higher than anything that you would do outside. So it's mainly US journals that they like to see your publications in. Another thing is step scores. Obviously, like any highly competitive specialty, high step scores are preferred. Now, the average for American grads is a 245. So you need to get at least above the average for an American grad. Would that make you competitive? No. In order to become competitive, you need to get at least 5 points higher than the average. So that would mean 250. So your ideal sweet spot would be anything above a 250 that would work. That would make you a competitive applicant to get into ophtho. The minimum would be 245. Is it the end of the world if you get something below 245? Absolutely not. I've seen a lot of applicants that have gotten below those numbers and still matched. And I'll show you how in a few minutes. So the other two factors, the visa issue, I've told you before, you sadly have to secure your own visa. And then creating strong links and forming strong bonds and connections with American physicians and program directors is one of the biggest routes to success here. Again, this is one of the specialties that people will tell you frankly that your connections could be so influential that it doesn't matter what your step scores are, how many publications you do, or anything. If you have a strong connection, you're set. That is why if someone scored very low and had one publication, if they have a strong connection, that's it. They are all set. So they don't really need, it's not one aspect of this application that would determine whether or not you match. No, it's multiple aspects together. And that's great because if you fall short in one of them, you could always try to enhance the other aspects of your CV so that you could get in. Having connections get you in has its positives and negatives. The positives is that even if you have a very weak application, that gives you always the hope and the chance that you could still get in. Versus if you don't have a weak publication in your publication, your CV in general is very strong, then you don't need these strong letters or these strong connections with program directors. However, you might find someone who's less qualified than you in the program. So it is very common where you would see an applicant and you would be like, how did this person end up in this position? They're much less qualified than I am. I wasn't put in this position. And that's where there are benefits and negatives to the whole connections part, where if you secure good ones, you could end up matching regardless of how strong your CV is. If you don't, then you might see people who are less qualified than you get in. So it's a double-edged sword. So these are generally the requirements to match. Like I told you, it's multiple factors. It's not one. Having it be multiple is a good thing in the sense that you could always enhance one aspect if you fall short on the other. If you could enhance all of them, that's even better. Okay, now there is a very specific route that most IMGs take when they come and pursue ophthalmology. And if you ask yourself, how can I hit 3 birds with 1 stone? What do I mean by the 3 birds? Out of the factors that I mentioned to you, the last 3, which is the number of publications and strong letters of recommendations and the strong networking, you can achieve that by doing one thing. And that one thing is a pre-residency research fellowship. What are these? These are programs or fellowships in the United States that provide you the chance of publishing a very large number of papers annually. And it provides you sometimes with clinical exposure, clinical training. It also funds you to go to different conferences, present posters and oral presentations. And it also provides you the ability to publish in very competitive journals sometimes, because these programs are usually affiliated with these journals. So it would give you the space to do a lot of research and publish as many as you can. Because you would be working with physicians in the US, it also gives you that tight-knit connection where you can prove your work ethic and your ability to, be productive in the workspace straight on, face on. When you work with this person for a year or 2 years, they truly see your value and they're more inclined to write a very strong letter of recommendation for you, versus when you do an externship or an observership for like a few weeks. Those letters are usually not as strong. But when you work with this person for years, they're more likely to vouch for you. And in fact, almost all of them always call for their fellows. It's almost always a given that they would write very strong letters, that they would call different programs to vouch for you. Even better, some of these programs, they're affiliated with residency programs. I know that the QI fellowship at Kresge Eye Institute is affiliated with Kresge residency programs. So that's why almost every year their QI fellow ends up matching into their ophthalmology program. So securing a pre-residency fellowship that gives you higher chances of matching is one of the best ways to kill those 3 birds with one stone and achieve matching early and with much less effort, because it gives you the connections, it gives you the letters of recommendations, and it provides you with the ability to publish as many as possible in that year. So there is a website that's published in University of Utah that shows you a list of pre-residency fellowships for ophthalmology that allows you to send your application to all these different programs, and it basically tells you where in the US it is. So as you could see, for here it says in the West Coast, and then it gives you where the program is, what the program is about. It gives you details on what the requirements are for their fellows, and some emails and contacts for you to contact these people so that you could apply for the fellowship. So this is a really great way to apply to all these pre-residency fellowships. Once you are secured in a pre-residency fellowship position, it is your gateway to matching. Most of these programs really fund and support their fellows and try to, as hard as they can, to get their fellows to match, because that reflects positively on them as a program. So you would have a lot of support into getting into ophthalmology if you secure one of these fellowships. Now, because they provide such a great aid into matching, getting into these fellowships is not as easy as people expect. Overall, in the entire US, there are 18 pre-residency fellowships. As of today, this number might increase or decrease with time. But as of now, there's 18 there. Some are on most are on this website, and then some are scattered all over the web. But applying to them requires a little bit of preparation. Every year, the application starts in January. That's when you get on this website, you look at these programs, and then you apply or send your CV to all these different contacts. Usually they interview their applicants by February, and then they release their accepted fellows by March. So by mid-March, if you did not hear back, if you did not secure a position, most likely all positions are already filled in majority of programs. There are always exceptions where there are programs that still accept some applicants in other times of the year. But generally speaking, March is the time where most programs release their fellows. And this is where I applied as well. So through this website, I was able to apply to all these different pre-residency fellowships, and I was able to secure one here in Boston, Massachusetts. All right, so I did create this ideal like workflow plan. This was if someone had the time, had the financial backing, and the visa status to pursue ophthalmology. This would be the ideal like route that you would take. It's preferred that you try your best to do your step 1 and step 2 before graduating. That way you can be completely free to pursue only research once you become a fellow or once you are out of medical school. Is it the end of the world if you don't do one of them? No, it's completely okay. I personally finished my step 1 in internship, and step 2 wasn't until years later. It was a lot more challenging though to balance research and step 2. So that's why it's always preferred if you would finish both exams before graduating. Then afterwards, you can start rotating in different rotations in ophthalmology locally. So Alfaisal provides great opportunities in King Khalid Eye Specialist Hospital, King Faisal Specialist Hospital, and Shemasi Hospital. There's also opportunities in Specialized Medical Center, I think it's called. So there's different ophtho opportunities at different hospitals in Saudi Arabia. Being exposed to that environment will help you determine whether this is a specialty that you want or not. And it'll also help you see the workflow, the everyday life of an ophthalmologist, and it'll help you form connections with those attendings. You could even start some research projects with some of these doctors. That's how it happened for me. I just happened to be rotating in King Faisal Specialist Hospital, and I went up to Dr. Maali, who I hope is still there. And I just asked her frankly if I could join her in a research project. She gave me one, and that was my first publication that I had. So it could even be a tie to publishing. And that's great, because if you publish papers in Saudi, even though it might not count as much for your match, but it will help you secure a good fellowship, research fellowship. The better your research background, the higher your chances in securing better research fellowships. Some research fellowships, they have a reputation of always matching their fellows into their programs. Those are the ones you want to aim for, and those are the ones that you want to try to get into as much as possible. So having a background in research and doing some publications beforehand helps you attain those positions. And then once you are in your intern year and you are going through these rotations and you're trying your best to involve yourself in ophtho rotations, that is the time where you apply for a research fellowship here in the US. Like I told you, the application starts in January. So January of your intern year would be the ideal time. By March, you would hear back on whether or not you were accepted, so that way you can start your fellowship year either in July. Most programs start in July of that year, or later. You could always call that program and tell them I need to start later. And most of them are very understanding, very accommodating. My program especially is extremely understanding. We had a girl that came in a year later, so it's completely fine. As long as you have the open communication with the program and you're clear about where your standing is, it's just important to at least land in a position, because that, like I told you before, is the biggest gateway into matching. After that, once you have set foot in the research fellowship, it's all a matter of time. So you will be exposed to a lot of research opportunities. You'll be able to engage in conferences. Most research fellowships fund their fellows for conferences. That includes their plane tickets, their accommodations and stuff like that. Work hard, try as much as you can to publish at least a minimum of 10 plus publications, and attend as many conferences as you can. Each program will be very different in terms of how much it allows you to engage in these conferences, but the more conferences you go to, the better. After you do that, you've secured your fellowship position, you have worked hard and you've published all those publications, then it's time to apply to the SF match. Most of the time, your program head or the person that you're working with in the fellowship are the ones who already write your letters for you and they call for you, and it's almost always a given. Very rarely do we find a program that does not provide that for their fellows. It's unheard of. So that's a great guaranteed benefit to these programs. And once you do apply to the SF Match, it's all smooth sailing from there. It's a very smooth, direct process. I showed you guys the website in my previous talk about how to apply to the SF Match. It's one website. It's very easy. You just fill out your information and your specifications, and it takes all the work from you. It distributes your CV. It allows the programs to analyze your CV and determine whether they want you as an applicant or not. They will send you interview requests. The website, it will organize your interviews for you. You get to do the interviews, and then match results for ophthalmology come out in February of every year. It's usually February 3rd or February 4th. Yeah, and obviously the biggest take home point here is to pray as much as possible. It is a very, very long route, but in my eyes, I believe it's highly worth it from all the positive notes that I mentioned in the beginning of my talk. Once you do get to that end stage, once you do enter residency, from there you are set career-wise. It's a very rewarding specialty. It combines both, like I told you, surgery and medicine, and the end result is very highly worth it. And most international graduates that have matched into these programs are very, very satisfied, and they're very pleased, and they see that the long wait was absolutely worth it. So I know that from what I mentioned, there probably are a lot of things that you're worried about. Here is a short list of things to not worry about when you do apply. One of them is year of graduation, and this is one of the biggest differences from the main NRMP match versus the SF match. In the general match, your year of graduation matters. And it's to the extent that a lot of Alfaisal students delayed their year of graduation so that they could have a later year of graduation, because the timing from when you graduated to when you match is something that a lot of programs filter applicants based on. My husband actually worked as a chief resident at one of the internal medicine programs. And as a chief, he was able to interview applicants for the match, and he was involved in the decision-making of which applicants were chosen. And so he frankly mentioned that one of the filters his program used was the year of graduation, that after 3 years of graduating, they filter you. They don't even look at your CV. So it's one of the biggest factors in internal medicine and family medicine and these kind of specialties, and even surgery. But when it comes to ophthalmology, thankfully, year of graduation is not an issue, especially for international graduates. And the reason for that is because they know that it takes years and years for you to reach the CV required for you to match. It takes years to publish more than 10 papers. It takes years to establish the kind of connections required to get in. So most applicants that do match have years of post, graduation experience. Some actually have decades even. I've seen 3 international graduates that matched into ophthalmology after practicing for 20 years in ophthalmology in their home country. We had a doctor who was from China who had worked 30 years in China and then worked a little bit in the UK and then matched here into ophthalmology. So their years of graduations were decades before, but they were still able to match. And majority of IMGs that match actually have more than a 5-year gap between the time they graduated and the time they match. So this tells you that the year of graduation does not matter for ophthalmology, which is completely different from the general match. Your age doesn't matter as well. Like I've just mentioned, people are different. Some are very young, some are very old. Your background doesn't matter. You still have the ability to match fairly, the same as any other IMG. If you don't have strong research experience before or strong knowledge about the field of ophthalmology, you also don't need to worry. So before I entered my research fellowship, my knowledge about the field was very, very limited. I could not examine people. I could not see, you know, the optic disc on a fundus exam. It was very difficult. The ophthalmology exam, physical exam, takes a lot of training. It needs a lot of manual skills that you will get over time, but these are all things you can adapt to. So even as a medical student, if you fall short on your knowledge or your skill base in ophthalmology, you do not need to worry about that at all. Most research fellowships, and even when you're in residency, you have all the time in the world to gain these skills and gain that knowledge at your own pace. So that is not something that would hinder you. Low research experience, even though the better your research experience, the higher your chances of getting into better positions. But even if you don't have that much research, it's okay. I only came in with 3 publications when I was accepted into my fellowship, and most of them were non-ophtho related. So it was not a hindrance to me to be accepted. Obviously, the more research you do in ophtho, the higher your chances are of matching, but it's not a big hindrance. You don't need to worry about it. Like I mentioned before, the fact that they look at different aspects of your CV is a great thing, so that if you fall short in one thing, you could always enhance the others. I have 3 international graduates that I know that have matched with very low step scores. And when I say low, I mean ophthalmology standard low, because I know each specialty is very different. I had one girl that scored below 230s, and I had one person that scored below 220s. So that tells you that it's still possible, even if you don't score high step scores. But they worked very, very hard to publish a huge number of papers, to establish extremely strong connections with different program directors. So you would have to work hard on your other aspects of your CV if you fall short in one of them. Okay, so other than step scores and research, is there anything else that you can do to enhance your chances of matching? Yes, the answer is absolutely. There are a few things that I'm going to mention here, and I'm going to provide some sort resources for you guys to check out at your own time. So observerships and externships are great. There are more in ophtho now than they were in the time when I was first starting. There used to be very limited ophtho positions when it comes to externships and electives, but now thankfully there are a lot. The earlier you get involved in these, the better you are likely to match and get accepted in different better positions. Social media following is a very big part of ophthalmology, which is shocking. You don't see that with a lot of other specialties, but ophthalmology is a very small, tight-knit community. Everyone knows everyone, and word goes around very, very fast. I've seen that very firsthand. If you impress your attending or the person that you're working under, they will talk about you. And there's many social meetings and conferences that ophthalmologists tend to attend and see each other with, and that's all they talk about. So social media following can be one platform for you to showcase yourself and your achievements and the things you do. If you are not, subjected to a lot of exposure to other people through conferences, for example, if you cannot attend them or stuff like that, using social media is a great way to represent yourself. Networking groups, there are 2 specific websites that are excellent. They provide so many opportunities for people who are interested in ophthalmology. One is called Young MD Connect. I will show you what it looks like, and I'll provide the link. But this website, it has helped me tremendously. It connects you to mentors that will give you personalized advice on how you can improve your own CV, to attain better chances. And it also gives you the opportunity to attend meetings and conferences for free. It gives you scholarships. It really just gives you a lot of opportunities to engage in the ophthalmology community. And because I told you before, your social networking in ophthalmology is a very big factor as to how likely you are to match. It could be the only factor even. Using these networking groups is very helpful. I'll show you more examples as we go along. So when it comes to electives and observerships, there are a lot of programs that give free electives for medical students. That's why the earlier you get involved with this, the better, especially in your early med school life. These two are websites that help international medical students to apply as well. One of them is through Kresge Eye Institute. As you can see, they have a clinical elective and they have a research elective for medical students. There's also Bascom Palmer's, which is one of the most IMG friendly area you will find in the United States. And they also allow international students to rotate with them. And they have a process that you could see on their website as well. There are many, many more, but these two I found to be the most helpful for me. And they have the most IMG friendly environment too. But you can apply to these while you're in medical school, and doing those over the summer will help boost your chances when it comes to finding research that's published in the US. You can engage with that, with these electives there, and it'll also help you form connections with American doctors during your rotation, and they'll be able to also provide you with letters of recommendations. This is a website that I personally use. It's called AMO Opportunities. Some of you might already know about it. It's an excellent website. It provides international graduates with the ability to choose the location, the specialty, the type of rotation that you do, whether you want it to be hands-on or less hands-on. It gives you the ability to tailor what kind of observership or externship or whatever it is that you want to do here in the US. Another great feature is that it provides virtual electives as well. I actually did one of their virtual ones, which was an ophthalmic pathology rotation, and I really loved it. And it was by a very senior doctor at Stanford University. So you could even end up in electives that are with very highly specialized and well-qualified physicians in the US at very high-end institutes like Harvard and Stanford. The only downside to this website is that the pricing can be very high. It can range between $1,000 to $3,000. The good thing is that Alfaisal has a connection with them, and there is a I think coupon for Alfaisal students where it gives them a discount. I was able to use that discount and it helped me honestly lower the price. But yeah, and when you think about it, if you do a virtual rotation and you pay, let's say $2,000, you're paying way less than you would if you were to travel there in person, because you have to pay for the flight, you have to pay for the visa, the accommodations, the living expenses, food, and all that kind of stuff. That is very costly when you come to the US. So doing these virtual rotations help a lot. And some of them even provide you the opportunity to engage in research after you're done with the elective. So the doctor that I did the rotation with, I was able to reach out to him and Dr. Lin, and he was more than happy to provide me with research opportunities after the elective as well. And it's a guaranteed letter of recommendation. So all of these rotations, whether it's virtual or in person, you have a guaranteed letter of recommendation at the end of the rotation. The quality of the letter obviously is determined by your performance, but you at least have that as a backing. So that's great. All right, so social media, like I said, it's a great platform to showcase who you are. The list that I provided here are some international graduates that have successfully matched into ophthalmology here in the US. One of them hasn't matched yet, but she's on her way. But they're amazing figures who have unique experiences and who share those experiences on platforms like Instagram, Twitter, and even YouTube. So I have Iman Tadib here, who has a channel called the IMG, and she showcases her experience of pursuing ophthalmology here as a Moroccan graduate. And she's great and she's very helpful. And if you reach out to her, she could help you with research. She could help you with other kinds of opportunities and gives you advice. These people are very approachable. They're very nice, and following them can help you be on track with some of the trends that are going on in the ophtha community. And it also helps you to view what other people have gone through. That way you can see how that reflects in your journey. All right, the networking groups, I told you the most important one is Young MD Connect. This is the blue one here on your left-hand corner. This is an amazing website. I actually got a scholarship from this website to attend a conference, and it was fully funded. The trip with the airplane tickets was funded. They booked us our hotel rooms, and they provided lunch and dinner and food and everything. All the accommodations was provided by them. So it's really excellent. It gives you the chance to interact with different American doctors here in ophthalmology directly, whether it's through email or through Zoom meetings. And it just gives a lot of good chances for international graduates. I highly recommend like connecting with this website. The only downside to it is that there is an annual fee. I think it's like $20 a year. That's the only downside, but it is worth it in my eyes compared to the benefit that you're getting. The other website is called SDN. This one's free. You don't have to pay for it. And here a lot of people share their experiences and matching statistics. And they also share availabilities in spots that open up. It's common where we see people who suddenly switch from ophtho or end up having an empty seat in a program, and SDN is where they would post about that seat. And so going on there, sometimes you might be able to find a position, a fellowship position or a residency position even, that you could get into outside the SF match. And some people were able to match successfully through that, through finding those open seats. So SDN is another great one. All right, so when it comes to conferences, there are many conferences in ophthalmology, especially here in the US. The top important ones I've put in a list here in descending order. The top two are the most well-renowned ones, which is the AAO, American Academy of Ophthalmology annual meeting, and ARVO, which is the biggest research conference of the year. So those two are the big two events. The more you attend from these conferences, the better, and the higher your chances are to match. I've also mentioned the dates of these conferences. They tend to stay around the same time every year. It might differ sometimes depending on COVID or depending on other factors a little bit. So it's good to always stay updated through their main website. But generally speaking, the dates that I've provided here are the ones that have consistently been the case in most years. So I also mentioned in brackets what you would benefit from these different conferences, because some conferences you want to target exactly what you want to do or take out from that conference, and others you want to be a little bit more loose. So for example, the top two, this is where most of the networking happens, and majority of doctors in ophthalmology attend these two conferences, AAO and ARVO. That's why, because most doctors attend these ones, this is where networking is at its peak, and there's always events and social events surrounding it. So attending those events is great from the networking aspect. For AAO, it also has an additional feature where most of the advanced technology in ophthalmology, the new machines, new tools, new medications, new drops are always showcased in this very large showcasing area at the conference. It's great. And so if you want to buy great tools, if you want to buy, or if you want to be up to date with the latest technology, AAO is the place to go. And that's actually where I met Dr. Sawal Hazat last year at AAO. We took some pictures there, but it's great to be up to date with technology at AAO. ARVO is the best place to post, have a research publication or a research poster or oral presentation, because that's where it's more research oriented. And if you have a poster or an oral presentation at ARVO, that is a very big plus in your CV. That usually showcases that you are a highly research-driven person. The third, which is Young MD Connect, this one is the most beneficial in my eyes of all of these conferences, just because it's tailored towards pre-residency applicants. So the others, you will find people at different stages, attendings and residents, fellows, post-fellowship. You'll find people at different stages in their career. But at Young MD Connect Live, it is mainly tailored towards pre-residency people. It provides wet labs for you to train to do procedures and to train to do surgeries even, which is very rare in other conferences. And it also provides very personalized advice. You get to speak with program directors directly. I was able to ask a program director exactly what it takes, for an IMG to match into their program, which is a great opportunity because it's very hard to interact with program directors. It could be very intimidating, but this conference gives you a very safe space. So I would definitely recommend the third one. The fourth one, Women in Ophthalmology. This one's a little bit biased towards females. It's great. It's very, very fun to attend. There's lots of goodies that you get from that place. But it's great to stay in touch with the female community in ophthalmology. It gives you advice if you're a mother, if you're a wife, if you are someone who is struggling to cope with both, life as a spouse or as a mom and as a figure in the medical field. Balancing both might not always be easy. So they give really nice advice and really nice tips and ways of how to manage that at that conference. The last three conferences are mainly to present posters or abstracts that you have. These are not really great for socializing as much. It's mainly for just the presentation. So it's the top four that are the best for forming connections. All right, so IMG experience. This is the part that I like to highlight the fact that it is possible. It's very possible. It's very attainable to get into ophtho, to match into ophtho. Many people have done it before. To my left-hand corner is a very short list of people that I personally know. There are other people's that I didn't have the time to think of what their names were, but there are many IMGs that have successfully matched, and if they can do it, so can you. And there is a Instagram community called Project IMG. It's great for all specialties, really. It gives you the experiences of international graduates who have matched in different specialties, where they matched, how they did it, what they went through exactly. It's great to follow. It's where I found a bunch of the people that I met in my journey, and it helps to see that other people that are struggling through the same thing, it gives you that reassurance that there's a light at the end of the tunnel, because pursuing ophthalmology can take a very, very long time, and it can be emotionally draining. The anticipation and the uncertainty of whether you're going to match or not can really weigh down on you, especially mentally. So seeing other people who have gone through the exact same thing and have reached there is really reassuring. And it gives you that boost that, once you do get there, hopefully it's all fun from there. So advice from program directors, I was able to interact with many of them, thankfully, that gave great advice. One is to try and not call it quits from the beginning. Things are a lot worse, showcased than what they actually are. People tend to really exaggerate how difficult it is to get in. It's not that bad. I've had people who, like Jacob, have matched from the first time they've applied after just doing 5 months of research, just because he landed in a very good pre-residency research fellowship that had a good track record of accepting its applicants. So he did his step 1 and step 2 in July. He started his fellowship in August. He applied to only one program in residency, only one. And he matched into that one program. So he saved a lot of money, and it only took him those few months. So it's not everyone that requires years, and it's very different from person to person. And it's not always as difficult and as intense as people make it seem to be. So always have hope, know that your journey will be different, and that the end result is what's worth it, regardless of how long the journey is. Okay, now what if after you've heard this entire talk, you're telling yourself, you know what, I don't have any chances with a visa. I cannot financially support myself to do this. You know, my family is in a financial strain where they need me to match fast, they need me to get into a position fast. What are my chances? If I can't do it in the US, what should I do? Well, it's not the end of the world. It doesn't mean that you need to close ophthalmology as an option. There are always other places where you can attain this specialty. And frankly, they're much more easier than the US. So the UK system is competitive than the US, a lot earlier in your journey. So throughout your journey, you're actually well paid, so you don't need to worry about finances as much. In Qatar, I actually have one of my colleagues at my batch who he wanted neurology here in the US, wasn't able to get to the US because of visa issues. And so he ended up doing or matching into ophthalmology in Qatar. And the great thing about Qatar is that they accept USMLE exams. So if you did the USMLEs and you didn't do the Qatar exam, they accept that. You don't have to do the Qatar exam. The Qatar exam is a lot easier, even if you didn't do your steps. So that's something you can pursue. And it's an Arab country with a very friendly environment. So that's another great option if you want to stay close to home. Egypt is an example. There's many other countries that have a much easier time of getting into ophtho than the US. So not being able to pursue it here is not the end of the route. You could always ask people who have been there. For example, my colleague who did the residency position in Qatar, his name's Ahmed Mishlah. I'm sure he wouldn't mind if he was asked about, you know, his application there and how it happened for those interested to pursue ophthalmology in Qatar. Yeah, and so there are always other places. You shouldn't close that door. Another thing you can do, if you can't do a residency program directly, you can do a master's program. And there are a lot of programs that are just 1 year or 2 years in either Harvard or Bascom Palmer's. These two are the main ones that are easier and they're funded. So especially the one in Harvard, it gives you a certain funding because it involves you to work and do research with them. And the one in Bascom Palmer's is great because it makes you have connections with that program. And Bascom Palmer's is known to be one of the most IMG friendly programs for ophtho applicants. So doing a master's program can help. I know one of my colleagues, his name is Mike Zan, who did a master's programs with Bascom Palmer's before he applied to ophthalmology. So that helped boost his CV significantly to help him match. Consider a dual specialty. So this is what one of the Alfaisal graduates did. She's a senior of mine who tried to get into ophthalmology and wasn't successful. She ended up doing internal medicine just because she didn't have the time to, not be financially funded. So she wanted to do internal medicine so that she could be paid. And then after internal medicine, she went back to trying to pursue ophthalmology. You could always do that. It does sound like a much longer route, but it's possible. In fact, the owner of my program, Dr. Foster, he is known to be a stellar at his field, but he did rheumatology and he did pathology in addition to ophthalmology as a residency. So people do more than one specialty sometimes, and it could work out. Thankfully, because of that, he was able to discover treatments for different diseases. He was able to understand other medications used in other specialties and how it affects the eye. And that's why he was able to discover some treatments for terrible eye diseases. And he became the founder of ocular immunology. So there are perks to doing more than one specialty. And that's definitely an option you can do. It's just a longer route. Last resort is to choose a different specialty. And I think that is one that should be your absolute last. Ophthalmology is definitely worth it. If you talk to the ones who've reached, they will tell you that every minute, every sweat and tear was absolutely worth reaching the end. So don't give up on it until you've tried and you feel like, that's it. I can't take anymore. But if you haven't tried yet, at least put in that first trial and then consider from there. Yeah, so that would be my last advice. Here are some take-home points. Like I said, I personally think that this field is worth the investment, especially if you're going to pursue it here in the US. Matching isn't easy at all, but it is worth it, and it is definitely worth the wait. At the end of the day, you will be seeing your colleagues match in other specialties earlier, and that might be daunting a little bit. But once you match into ophtho those years later, and you're set for life, it'll be all worth the wait. Start preparing early, make your plan. I've provided a lot of resources here that you guys can use. I was not aware of those resources when I was at an earlier stage, whether in med school or after med school. So having them all in one place is a huge positive value. So hopefully you guys can make the most out of them. Surround yourself with motivation. It is a long road, and so the biggest key factor to staying on that road is to have a support system around you. Family, friends, husband, mentors, anyone who sees your potential and to get there. Keep those people tight around you for when those times when you feel like, you're completely unmotivated. At the end of the day, Allah's plan is the best plan, and it's the one that, is best for you in your life. So always pray and keep your religious ties strong, and hopefully you'll get there. So I just wanted to finish this talk with this very short video. Give me 1 second. I'll just play it real quick. All right.
Hi, I'm here for the interview. Oh, hi, come on in, have a seat. That'll be all, Jonathan. So why do you want to go into ophthalmology? Well, I'm a huge nerd and I don't think eyeballs are gross. What's your greatest fear? Being the only doctor on a flight during a medical emergency. What's your second greatest fear? Body medicine. What are the 3 most terrifying things about the hospital? The emergency department, the ICU, and that it doesn't close on the weekend. What will be your top priority in your first 5 years as an ophthalmologist? Forgetting 99% of what I learned in med school. Do you know any foreign languages? Just ophthalmology. What are your hobbies? Making silly videos on the internet. What does the heart do? Perfuses the eyeballs. Does it do anything else? Probably. Finish this sentence. An ophthalmologist, dermatologist, and radiologist walk into a bar because it's 3 p.m. on a Friday and they've already started their weekend. Well played. There's only one thing left for you to do. Spell ophthalmology. 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 Well, thank you for your time. You'll be receiving a thank you note from my loyal scribe, Jonathan. Wait, you have a Jonathan? Yes, of course. Oh, that's great. There's so many wonderful things about having a Jonathan. He does all my documentation for me. I don't have to look at it at all. I just look at the patient. He also carries me around clinic on his back. I wish everybody could have a Jonathan. So sometimes Jonathans are kind of hard to come by, we can just find them.
So this is a figure that I'm sure most of you probably know or have seen before. This is Dr. Glaucomflecken, who posts really funny and amazing videos. He will attest to how incredible this field is. And that is the end of my talk. If you guys have any questions or anything you want to ask, go ahead.
Thank you very much, Doctor, for the very informative presentation. I'm sure everyone in the audience found it very beneficial, and we really value your experience and guidance. To everyone in the audience, thank you for joining us, and we hope that you found the session as informative as we did. Now, if you have any questions, you can ask them in the chat. And before anyone leaves, please make sure to follow us on social media so you can stay up to date with our events. I've sent the links in the chat. So if anyone has any questions, you can unmute your mic or you can write it in the chat. Well, until we see any questions, thank you very much, Dr. Fatima, and everyone in the audience again.
All right, thank you so much, Rafi. Appreciate it. Good luck, everyone.